Here we have a patient who is ideal for RISIO aligners. We don't have that much crowding in the upper, just a little bit of imbrication, and down in the lower we seem to have a little bit more imbrication than the upper. The overjet is not massive, it's about 4 millimeters, and the overbite isn't excessive either. The sagittal is class 1, which is good. So basically in this case here, alignment in the upper, alignment in the lower with some IPR. We class this as a mild to moderate case, which is ideal in this case. And we will be reducing the overjet and of course aligning the teeth. So the patient now has agreed to have the treatment with the aligners, RISIO aligners. We've discussed the options with the patient and they've signed the consent forms and they know the pricing. And so you go onto the portal and you go for add patient. And as you add the patient here, you put in the name, of course. We're just going to make up a name here. And then you put in the date of birth, you put in the gender, email option, phone number, and then you can then go here. Now, the minute you go onto the next page, it's very good because basically all you need to do is press, when you have your phone, you click here to use the phone, and you can download this QR code. That then automatically uploads the patient's details onto your phone, and then you can use your phone to take the photos. And the minute you take the photos, they're uploaded onto the portal under the patient's details and then eliminated from your phone. So it doesn't, take all the memory on your phone, which I find this feature very, very good. And here, of course, are the details of what type of photos you should be taking and the quality of the photos that you should be taking. Don't forget that the quality of the photos are very important because that's the only information the technician's getting of the patient. And therefore, if the photo quality is good and the detail is there, you will then get a better a possibility of the treatment plan that can be then created for the patient. So when the photos then are uploaded, you go next and you create an order. Okay, the minute you create an order, you have the options here: aligner, retainers, whitening. Of course, when you finish with the aligners, you need retainers and you may need whitening at the same time. So that's afterwards. So here we're going for aligners, and here you have the option RISIO aligners 12 or 24. If you click, for example, you're not sure and you click 12 and then RISIO decides that you need more than 12, they will let you know. If you click, for example, 24 and they decide, no, you only need 12 or less than 12, they will let you know. So basically, don't panic at this stage if you don't really know what to click. RISIO will let you know. And then here you have the option of upper only, lower, upper and lower, or just lower, or just upper. It's up to you which arch you are treating. Then you go into protocols. You have RISIO protocols and you have custom protocols. If you click those, they will give you the different options as to which ones you are going for. You select your dentist here, and then you can go in here. Your order then here is select which teeth need to be restricted from moving. For example, if you have an implant or you have a bridge and you don't want it to move, of course, then you click the teeth that you don't want them to move from. Teeth that should not receive attachments, where you don't want to have attachments put on certain teeth, you can click here, and then teeth to be extracted. You can click there. And then here you need to be having either standard impressions or uploading any of the scanners that you may have. And RISIO takes scans from all the scanners. So it will take CEREC, Trios, Carestream, iTero, and all the scanners. And you can upload those. right? So when you upload those, then you can then come here and you can write here any notes that you want writing. For example, you may want to have a composite buildup of, say, a peg-shaped lateral, and you can write down, please leave 1 millimeter mesial of the upper right 2 for aesthetic buildup, or something like that. Or open up the space for an implant. You can write down, please open up 7.5 millimeters in the upper right 4 region, or wherever you want it to be. So then the technician knows then that that's really what you've asked for. After you've done that, you then go on, then everything is then uploaded, of course, here. Your notes are written here. You then submit the order. Boom. Click that, and that then gives you then the patient number and the order number. These will be related to you all the time from RISIO. Whenever you correspond with RISIO, they will always ask you what the patient number is, so they know then they're talking about the right patient at any one time. Then when you submit that within 72 hours, you will get then the treatment plan sent back to you. When you have had a look at the treatment plan yourself and you're happy with it, then you call the patient in to show them together with yourself so you can have that approval done. If you're not happy with the treatment plan, you write back then to RISIO for whatever modifications you desire, and they will then modify it and send it back to you. And then we then move on to the next stage where the treatment plan has come back, and then we then discuss that with the patient. All right, Lucy, so now we have your treatment plan here.
Yeah.
Okay, we're going to go through it with you. So these are your teeth here, all right? Now the blue bits here are little attachments that we're going to be putting onto your teeth just to be able to, the aligners then can then grab the teeth a little bit better with the attachments on. They're only glued on, so don't panic. It's not they're not drilled in or anything, okay?
Okay.
And they're tooth colored, okay?
Right.
And then afterwards we just like polish them off, and it doesn't damage the teeth in any way, okay? So this is then how your front teeth are looking at the moment, and that's how then they're going to be moving to get your teeth straightened out, okay? So let's have a look at them sequentially now. Let's get it on the, let's enlarge it. So we click on the right hand side, and I can enlarge this then. And then let's have a look at the upper one first. That's your upper teeth there. We click here, we go up here, and we can then enlarge it here. So this is how your teeth are looking at the moment. You can see it here, and then when you click here, you can see then this is how your teeth are going to move. All right, that's your top teeth. Your bottom teeth are like this. They're more crowded, your bottom teeth.
Yeah, they are.
They're more crowded, aren't they? So these are your bottom teeth here, and then this is then the movements to get your bottom teeth straightened out, okay?
Lovely.
Now let's have a look from the sides, because you were worried about the overbite as well, you said to me. So let's have a look then at the sides here for your overbite to see how they look. This is how your overbite is here. And you can see when we click on here, you can see that that's then being reduced.
Yeah, big difference.
Yeah. So let's click around again to the other side and see the other side as well. There's your overbite here, like that, okay? And then you can see here, that's your overbite. And what we're going to be doing is your teeth are going to move like that, and then that's your overbite is reduced. All right.
Yeah.
Great. Now, when we also then go back here, as you can see, because your lower teeth are quite more crowded than your upper teeth, we do need to do a little bit of polishing between the teeth, and the polishing is indicated here, and it's only 0.3 millimeters. Now, 0.3 millimeters is very little. It's very tiny. Doesn't hurt, okay? And we're going to be doing that then today, because it says before aligner number 1.
Right.
All right, aligner number 1. So we're going to be finishing then all your polishing then today as well, and then we're going to give you a few sets of aligners to carry on with, okay? We will now then approve that, and when we send it then back to RISIO, the aligners will be back in about 5 days. Okay, and then 5 days is when they'll be back, and then we will then fit the attachments, and then we'll do the polishing, and then carry on from there. Is that okay?
That's fantastic.
Right. Now, the other thing to mention is that how many aligners will you need? You will need 12 aligners, it says here. Step 12 of 12 12 aligners, you change them every 2 weeks. So that's 24 weeks of treatment. Okay. Yeah. And that's what we have here. Okay, so if you're happy with that, then we're going to approve it. Yeah. And then the aligners will be back in 5 days. Then we'll fit everything there. And in the meantime, we'll send you the treatment plan to your phone, to your mobile phone. Then you have it and you can look at it anytime. Amazing. And of course, if you've got any queries, just let us know. Is that okay?
Yes, thank you.
That's great. Thank you. So the aligners have come back from RISIO now for the particular patient, Lucy. And we, of course, have to check before the patient comes in or before we make the appointment for the patient to make sure that everything is here and we're happy with everything. You have the indication of where the attachments are going to go and the amount of IPR that needs to be done, where and when. And then you have then here an instruction sheet for the patient that says start your journey with aligners, indicating how they should be handling the aligners, when they should be wearing them, how they should be cleaning them, etc., etc. And then in the box, you have then the aligners. And then the most important thing, of course, is to take the attachment template and make sure that when you open then the attachment template box, that the attachments that are on the aligner match what is on the sheet here. And we then go through that and then take it from there. So now the patient's back for the fit of the aligners. Of course, we have some attachments to fit. And so we have the attachment template here, which we've checked with the paper template. And we've marked here with a black marker where the attachments are going to go. That's the lower arch. And here is the upper arch. So I'll be using that now to etch the teeth in the exactly the right position as where these attachments are going to go. We don't go and put them, the etch all over the tooth. Okay, so we're going to start that now. The cheek retractors are in. We get now the saliva ejector. Open wide first, please. Bite together. Bite together. Bite. Just bite on that. And now we dry it. No, dry. Sorry. Fine, thank you. Sorry, I'm waving at me. And now we take the edge. We take the bottom and we look exactly where the attachment is going to go. That's the lower. Now we have the upper. So we wait for that to work. In the meantime, your nurse will be filling then the attachment templates. So now 30 seconds have gone. and we take then the edge off. You can keep filling. You can keep filling. Open a bit for me now, Lucy. Can you open? Open? Okay. You bite together again. Thank you. Open again, please. And bite together again. So when you fill the template, you've got to make sure it's not overfilled. Open wide for us, please. And it's very sensitive that everything is absolutely dry. Open wide, please. Bite together, please. So make sure that everything is absolutely dry. Now we've got to look at this. 3 to the 5. And now you have the bond. And we use this 3M Unitech bond. It's then put onto the teeth. Just need a template, please, Lisa. No, the aligner. Thank you. Open for me, please. Then the attachment template goes in, and push very gently with your finger onto the attachments to make sure that they're actually seating properly. Okay, then you take then a tweezer and you push onto the attachment. A bit more towards me, please. To set it on each one. To make sure the attachment is pushed right onto the tooth. A bit more my side, please. Thank you. Right, an example of pushing it on is like this. The tweezer goes on around the attachment and then, yes, and then you set it like that, okay? So that's the way to do it, like this. Then once you've done that, you just go around one more time, make sure that everything is set properly. Right, that's the bottom in, and now we do the same for the top. So you make sure that everything's dry again. And then you put your bond on, move the light away slightly. Open wide again, can you take the saliva ejection? Then you put the attachment template in and the upper, press it again with your finger very gently on each one. And then you go through the same process of holding it with a tweezer. Set that one, please. Set the 5. Okay. And now you can peel off the templates. And you can see the attachments are on there. Hardly noticeable. You can see that there. And now we go around and we make sure that around the attachments we don't have anything in any excess. So you flick that a little bit with a probe. Yep. Okay, now we've got the attachments on and we're happy with that and we've polished around the attachments. We are now then ready to do the IPR, the interdental reduction. Of course, we take then the IPR sheet. We know exactly where we're going to go and how we're going to do it. Now here you can see that it's more the posterior that we need to be doing the IPR with. And therefore, for access, it's better to use a interdental burr, which is like this, to go between the teeth, and then to reduce then the amount that you need. Here we need 0.3 millimeters. So the attachments are on anterior, we would just be using then more of a kit like this, which would then we'll be able then to use it in the anterior region to go between, and you can see here that they are graded in different thicknesses to get us the width that we need. Okay? So we're going to start with the IPR in the posterior region. Nice and wide, please. Really wide? Open wide again. Thank you.
Okay.
Nice and wide again for me. Can we get the measuring? And then we measure then, it's 0.3 millimeters. So we take then the IPR measuring guide and we go to 0.3, which is here. And then we go between the teeth, open wide for me please, and measure to see it's 0.3. You can see there, that's 0.3. I think we'll get some suction. There's a bit of blood there. Keep suction going, please. And that is 0.3. So 0.3 has been done. On this side, we carry on the other side and do the same. Open wide again. Yeah. Okay, why did you come for me? Sorry. Okay. So we've done the other side now, and we measure again. Yeah, 0.3. That needs a little bit more, just a little bit more on that side. Open wide again. Okay. So the bottom is finished. One thing you have to be careful of is the fact is that you do go through the contact point completely. You don't go just on the top of it. You've got to make sure that the measuring gauge goes right through the whole contact point, doesn't catch anywhere. So you know you've got the amount of distance you need to allow the teeth to move into that area. Okay, it's very important. Now we're going to go to the top, and we're going to do the same for 3 and 4, 4 and 6. Yeah. That way a bit more. Really wide now from the loosely point. Bit wider, 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 wider. Okay. So now we measure those. 0.3. To hit that way again. Suction, please. Perfect. 0.3. 0.3. You can see the blanching of the gingiva as I push the measuring instrument through. And you've got to have blanching of the gingiva when you push the instrument through. That means that you're all the way through the contact point. Where people get it completely wrong is they don't go through the contact point subgingivally. And therefore you don't get the room. Okay? Right, last one. 3, 4, yeah. Wide as you can, darling, please. Really wide. Just stay like that. Bit wider, wider, wider. Bit wider, wider, wider. Follow. Almost done. Well done. Just give me the measuring thing then. So we measure that again. Suction, please, again. Thank you. So that's your polishing finished. Okay? Now, in the side segments here, because this is a very fine burr, we don't need to do any polishing. But normally you would finish off with some finishing strips to finish, because that's a very fine burr. And that's so it's polished at the same time. Now we're going to put the first aligners in. Open wide now. And we put them in and we push them in like that. And make sure they're seating right down and over the attachments. You can see here that they're fitting perfectly over the attachments. That's very important. They're not seating over the attachments, they're not seating. All right, it's quite important. You take the bottom ones, you do exactly the same. You put them in, you guide it in, and you push them in. Back, back, down, and make sure they're nice and tight. This is how they should fit. Okay, flush here and flush there. Okay, very important. Now, we do have some accessories that come with them. And these are called chewies. Okay, they come with the box of aligners for free. And there's two things in here. There's one thing you have is that you have the hook that you can use to take the aligners out with. Okay, that's included. And you have these things called chewies. Okay, I'll show you how they work. Can you open that for me, please? The hook, of course, is quite easy. You put it here like that, you put it to the edge of the aligner and you pull down with it and it'll take it out. These chewies are very good because they should be used when you fit every aligner, every new aligner. And the way they work is like this. You put it here, bite together for me. Open wide, bite together. Open wide again, bite together. Open wide again, bite together. Open wide again, bite together. Like that to make sure they seat right down, okay? And the chewies like that, they're not going to break or anything. There's two included in the box that comes for free for the patient, okay? And that's the way it goes then there. What I normally say to the patient is take your phone and take a photo of your teeth now take a photo of your teeth now that the aligners are fitted down to show how they should be fitting every time. So they have a reference photo. And then, of course, we go through how to take it out and in. And if the patient's comfortable, are you comfortable?
Yeah.
Okay, I know it's new, it's comfortable. Speech may be deterred for a while and saliva may flow because it's a foreign body in your mouth. But apart from that, you go through then how to take it out, how to look after it, and then basically give a few more aligners. Of course, aligners are only given until the next date of the IPR, okay? In this case, all the IPR has been done now at the fitting. She doesn't need any more IPR, so we can give her quite a few aligners and then get her back in for a check and make sure everything's okay. If they have any problems, of course, they give us a call, we see them and we'll take it from there.